Hi everyone, this is Chandra Sekhar from Chandu biology classes. So in this particular session, I am going to discuss how a PharmD student can do the PhD and what are the various career opportunities for the PharmD students and what kind of entrance exams can be written by the PharmD students in order to do their PhD in India as well as the abroad, and what are the famous research institutes in India that they can do PhD. And most of the students are having a confusion that they have to do the PhD only in the clinical pharmacy or the hospital pharmacy or the community practice. The PharmD students can do the PhD in various kinds of disciplines. We are going to discuss everything in detail. Right. So friends, before explaining, what are the exams that you people can write. So first, let me quickly summarize what are the career options after PharmD and what are the payments or annual compensation or the salaries. See friends, there are many opportunities are there, but whatever the opportunities that I have highlighted are the most common. Most of the students will try to approach for this kind of jobs. So among those, the first one is the retail pharmacist. We all people know that a retail pharmacist is a person who gives healthcare advice, right? Who will prescribe the medicines based on the prescription, even who can prescribe the medicines even on the non prescription also, right? So most of the independent pharmacies, other businesses, typically retail pharmacist, wholesale pharmacist, those people use it to recruit these retail pharmacists, and the annual salary will be ranges from 2 lakhs to 4 lakhs. Then next one, medical writer. What is this medical writer? Whether it is a pharmaceutical company, whether it is a big corporate hospital, or whatever the healthcare association it may be, they always require a medical writer. So medical writer is the one who actually create various scientific documents on the pharmaceuticals, or who create a scientific documents on different kind of diseases, who can publish several articles, who can publish several promotional literatures, who can prepare a lot of content for the healthcare website, for the journals, as well as the for the newspapers, right? A medical writer can make roughly 3,50,000 per year depending on their experience. And whatever the 3,50,000 that I have mentioned here, this is exclusively for the fresher. And I can say that friends, this medical writer is exclusively depending on your intelligence skills, how depth you can read that particular subject, and how effectively you can publish an article, or how effectively you can write an article. The next one, clinical pharmacist, right? Right, clinical pharmacist as well as the hospital pharmacist, these two are also two most important jobs that every PharmD students can do, or most of the PharmD students interested to do this. So what is the exact role of a clinical pharmacist? They are the one who actually advise their patients on how to use the medicines correctly and how to use the medicines very safely. And you know that all the clinical pharmacists must be experts in the therapeutic use of medicines. So friends, I'm talking about in India, on an average, a clinical pharmacist will get 3 lakh to 5 lakh per year. Of course, that is also exclusively depending on their experience only, right? And career options, if you look into as an analytical chemist. So friends, analytical chemist is really a very interesting job where you have to use your complete skills, because it is purely what we can say that research based job. Your ultimate goal in this particular analytical chemist is most of the analytical chemist has to study or has to do the research on the chemical composition and behavior of various type of salts as well as various type of chemicals. Most of the clinical research laboratories, most of the forensic science laboratories, most of the bioanalytical laboratories, they use it to recruit this particular analytical chemist, and the salary will be starting from 2,50,000 to 5 lakh per year. And what about the drug inspector? So you all people know that very famous job. What is the ultimate aim of a drug inspectors? They are the one who are in charge in preventing the drug piracy as well as duplicity, right? So all the drug inspectors having the responsibility to investigate a lot of chemical store or the pharmaceutical corporation, because in India especially the illegal substances, it became more popular. So in order to eradicate or in order to prevent this illegal substances, so that drug inspectors on a constant basis, they will start, riding on various chemical store or as well as pharmaceutical corporations. Of course, they are having other various activities as well. Drug inspector annual salary will be 3,50,000 to 6 lakh. And friends, whatever I said here, excluding HRA. So you will get HRA also, and you will be having other allowances as well. And apart from this, what some of other PharmD students will do who are really good in terms of the teaching, they will move into the teachers, or the people who are really good in terms of the research, they will join as the research associates, and many more are there. Whatever I have highlighted here is the most of the common jobs that will be preferred by the PharmD students. Now friends, what kind of government jobs that a PharmD graduates can apply? They can apply in the government hospital as a clinical pharmacist, as well as the hospital pharmacist or the community pharmacist. Even you can work in the CRPF, Pharmacovigilance, Staff Selection Commission, different government colleges and universities. But for most of these jobs, a PharmD student compulsory required a PhD, right? But if you look into the same job opportunities for the abroad, most of the time you do not require the PhD, but some organizations even in the abroad also, they will look for the candidates who completed their PhD. So friends, these are all the top 14 jobs which are trending in all the Europe countries, as well as the UK, as well as in the US, for the PharmD students. Hospital or clinical, community pharmacist, pharmacist assistant, pharmacy technician, patient counselor, analytical chemist, drug storage management person, clinical research, drug information pharmacist, ambulatory pharmacist, pediatric care pharmacist, e-prescription pharmacist, e-pharmacy pharmacist, and medical coding special care pharmacist. These 14 are the most trending jobs in the abroad for the PharmD students. So now, before explaining about the opportunities in the abroad and how to go to the abroad, first let me explain you friends how the PharmD students can do the PhD in India. See, most of the students, let me tell you one thing friends, okay, let me be very honest. Every student who is studying the PharmD, we really worried about our career. The reason is that when you look into the abroad, listen my statements correctly, all the foreign countries are patient oriented, whereas India is what friends, we are product oriented. Try to understand my statements. All the foreign countries are patient oriented, we are product oriented. You know very well, out of listen my statements, out of 4 tablets consuming in the world, one from Indian market. So we are a very largest manufacturer in the world. But when it comes to the patient health care, we are in a very least position. We are hardly in the 39th position in healthcare sector. And out of 4 diseases that are spreading in the world, at least one disease is coming newly from the India itself. So friends, so when compared to the foreign countries, since we are a product based company, the career opportunities for the PharmD students are not greatly promising. Even though you are getting a job, they are not high pay scale jobs like abroad. Okay, so but in the future, this scenario will be changes. Even PharmD student also will get a very good pay scale in the upcoming, in the upcoming days or in the future, but not currently, right? So most of the PharmD students are doing what? Whomever having a keen interest in the research, they are writing a various PhD entrance exams. They are settled in the research. Or some people, what they will do, once they completed their PhD program, they will apply as a assistant professors, in any government colleges, as well as well-recognized pharmacy colleges or universities in India. So let me explain you what kind of entrance exams that PharmD students can write in order to enter into the PhD program. So the first one is NIPER PhD entrance exam. Right. And you people ask me, sir, if I qualify the NIPER PhD entrance exam, can I do the PhD anywhere in India except NIPER? No. If you qualify the NIPER, we generally called NIPER JEE. If you qualify this exam, you are eligible to do the PhD only in the NIPER campus. Right. Then CSIR UGC NET exam. This is the most famous exam. that every PharmD student has to write compulsory in order to enter into the PhD program. So if you qualify either CSR UGC NET or the GATE Excel or ICMR or DBT, these four are more prominent exams, friends. If you qualify any one of this exam, you can do your PhD in any institute in India, any kind of institute. Apart from that, we are having TIFR, we are having IISc PhD entrance exam, and some of the universities will conduct their own entrance test. By that, they will take you into the PhD program. Apart from CSR, UGC NET, GATE Excel, ICMR, and DBT, I encourage every PharmD student to write the entrance exam for the AIMS also. Trust my words, friends, the AIMS entrance exam will be very easy. But most of the students, what they think that the AIMS entrance exam is really difficult. People, by considering it as a difficult exam, most of the PharmD aspirants never give the exam only. So I'm requesting all of you, give this exam. Give this exam. It is really easy exam when compared to the CSR UGC NET exam. Now, the major doubt that is there with many students is, sir, in what disciplines that a PharmD student can do the PhD program? What we think is only clinical pharmacy or pharmacy practice or a community pharmacy or a pharmacovigilance, only this. No. Once you qualify these national level exams, friends, you can do the PhD program in any discipline. After once you complete your PhD, you can start teaching in any colleges, even in these disciplines. Listen my statement. It is not necessary that the PharmD student has to teach only hospital pharmacy or a community pharmacy or a clinical pharmacy subjects only. It is not like that. Once you completed your PhD, whatever the PhD specialization you are, you can work in that particular field as well. You can teach even that specific subjects also. So a PharmD student can do in biochemistry, microbiology, as well as genetics, drug research, cell biology, molecular biology, pharmaceutical technology, pharmacology, pharmacy practice, clinical pharmacy, and many more. Whatever I have highlighted is the top trending fields that every PharmD student can easily apply and can start doing their PhD, right? And many students will ask me, sir, what are the best research institute that a PharmD student can do their PhD? I can say that, friends, in India's the #1 institute, from the last 100 years, which is the IISc Bangalore. Okay. In this IISc Bangalore, you can do your PhD in biochemistry, genetics, molecular biology, as well as the infectious diseases and many microbiology and many other disciplines are there. Okay, one of the very prestigious institute and where vast research is going on, and most of the professors from the MIT, where you can get a wonderful research experience. Then followed by the TIFR, Tata Institute of Fundamental Research, which is located in the Mumbai. So TIFR also, friends, it is extremely good if you are interested in the drug research. I am talking about the PharmD students. For the life science student, there are many other options are there. IISER, there are many IISERs are there in India. IISER Bhopal, IISER Kolkata, IISER Pune, IISER Thiruvananthapuram. There are many IISERs are there. So even in the IISERs also, wonderful research is going on. Even though if you get the admission into the IISER, you can join into this IISER very easily. And especially most of the PharmD students who are keenly interested in the research, they try to do their research. I mean to say, they're very fascinated to do their research in the CCMB and CDRI. Center for Cellular and Molecular Biology, which is located in the Hyderabad, Central Drug Research Institute, which is located in the Lucknow. So friends, in these two institutes, it's a pure drug research. Okay, CCMB, even other disciplines are also there, but it is very famous for the drug research along with the CDRI. Bose Institute, which is located in the Kolkata, this is also extremely good with respect to the research programs, especially for the PhD as well as the postdoc also. Then followed by the National Center for Cell Science, which is located in the Pune. NICER, which is located in the Bhubaneswar. Again, JNCSIR, Jawaharlal Nehru Center for Advanced Scientific Research, which is located in the Bangalore. Whatever I have mentioned here, a kind of top 10. There are hundreds of research institutes are there in India. If anyone is interested and if anyone wants to know keenly about the research, I mean to say research institute, if you message or call me, I'm, we'll be always available to give you the entire information. Now, how to prepare for this particular competitive exams? See, PharmD students will ask that, we are purely from a pharmacy background. We never read this particular life sciences subject. Whether it is the CSIR, whether it is the GATE, whether it is ICMR, whether it is the DBT, here what will be the syllabus? The syllabus will be, with respect to the life sciences. Some of the chapters we people never read in our pharmacy background. See, if you look into a PharmD subjects, in the first or second year we read little bit about the biochemistry, we read little bit about the molecular biology, we read little bit about the microbiology. I don't know, some pharmacy student couldn't study the microbiology also. Pharmacy people, B.Pharm, M.Pharm people might study little bit about microbiology. Only pharmacy students might study little bit molecular biology as well as the biochemistry. Remaining all the subjects will be, it's not difficult, I am saying. At the same time, they are not that much easy also. If anyone wants to crack the CSIR UGC NET exam, being a pharmacy background, I'm requesting all of you, if you really spend 6 to 9 months of a dedicated time, I'm using the word dedicated time. Some people, because of their busy schedule, they couldn't study properly. They hardly use it to spend half an hour, 1 hour, and they try to give the exam. Trust my words, friends, this exam never works in that way, because all the questions are analytical, experimental, logical, numerical, and graphical questions. In order to answer these kind of questions, the student should have from very basic to the advanced knowledge on the concept. Then only they can crack this particular exam. Okay, so friends, from the from the February 1st onwards, there will be a new batch is starting for this particular CSIR NET exam, right? From the February 1st. If anyone is interested, you can call on the below numbers to inquire about the course. Okay. Thank you all. I hope the discussion is little useful to all of you. Thank you all.